For the average baby, the first birthday comes with lots of milestones, first steps, first words. But that's the average baby. Your baby may or may not be saying words. If your baby's not saying any words, does that mean that your baby's progress is not normal? Hi, I'm Krakower. I've raised 5 children of my own, and I've been the director of Cornerstone Speech and a speech-language pathologist for decades. My goal in these YouTube videos is to help you, the parent, understand your child's speech and language development. And I'm going to tell you something in this video that you're not going to read anywhere else. Sure, I could read you the developmental tables, but you can get them anywhere. I'm going to tell you, after assessing 1-year-olds for more than 30 years, what I have learned not to worry about at all. By the end of this video, you will know what is average development, you'll know what's normal development, you'll know what indicates that your child may need help, and you'll know what I say not to worry about at all. Parents always ask me, how many words should my baby be saying? Well, that depends upon whether you're looking at what the average child does or what 90% of children do. Now, of course, average means in the middle. They look at when children say words and how many words they say, and then they put a number in the middle, and that's what the average child does. But the other measure is what 90% of children do. Why this other measure? Because being below average is not abnormal. Half of children are below average, and most of them will catch up and never have a speech or language problem in their life. So how do we identify the children who may be having a problem? It's by looking at what 90% of children do. So when you look at developmental tables, it's very important for you to understand whether you're looking at a table of what the average child does or what 90% of children do. So take a look at this developmental table right here. You can see that the average child says 5 words on the first birthday, but 90% of children say at least 1 word. At 18 months, the average child is saying 50 words, but 90% of children are saying 10 words. By the second birthday, the average child is saying 260 words, but 90% of children are saying 50 words. So, what does this mean for you and your child? First of all, it means don't fret if your child is below average. This is not a race. Consider children's weight charts. Now, the average baby weighs 27 pounds on the second birthday. You could have a healthy child that weighs more or less than 27 pounds. However, if your child weighs more or less for a reason, such as an underlying condition, your child's weight may not be normal. And of course, the further you are from average, the more likely that it is not normal. But I have learned over the years that there's tremendous variability in how many words a 1-year-old says. So I'm much more concerned with how the child understands language and how the child communicates. Now, here are some things that I would be concerned about, and you can take a look at your child and see if your child is doing these things. When you call your child's name, does he stop and respond? Does your child pay attention most of the time when someone is speaking to him? If someone is at the child's face level, does he pay attention? Does your child notice other people and greet them, interact with them, and wave bye-bye when leaving? Is your child able to follow simple directions such as get your shoes or give that to mama? Can your child follow pointing? When I evaluate a child in my room, I put little toy farm animals around the room, and I always say to the 1-year-old, oh, get that cow over there. and I'm looking to see if the child sees where I'm looking and follows my pointing to go and get the toy cow. Can your child look towards or point to familiar people and things that you name? If you say, "Where's Grandma?" does your child look in the direction of Grandma? When you're reading a familiar book and ask your child to point to the cow or point to the horse, can he do it? Can he point to major body parts, such as his head, his hair, his eyes, his mouth, his nose, his ears, and his foot? Can he point to articles of clothing, such as his shoes, his socks, his pants, his shirt, his hat, and his coat? Does he shake his head no to refuse things? Does your child bring you things to show you? This is important because it demonstrates that your child is trying to communicate with you. Is your child babbling, saying jargon that sounds like real words even though they're really not words? If your child is not able to do most of the things that I just mentioned, please bring your child to a pediatric audiologist to rule out hearing loss. Now, I know you're saying, wait a minute. He hears. When a garbage truck comes down the street, he runs to the window. Well, the sound of the garbage truck is a different sound than speech sounds. And there are many children who have fluid in their ears or any one of a number of issues where they're not hearing as well as they could. And if they're not hearing well, they can't speak words very well. So we do want to rule out hearing loss. There are also a couple of structural issues that prevent a child from saying words in the first year, and I'm going to make some separate videos on those structural issues. I have what I call a line in the sand when I think a child needs a speech evaluation. But before I tell you the line in the sand, press the subscribe button so that you don't miss any of these videos on your child's speech and language development. Okay, so there's tremendous variability in how many words a 1-year-old says. If your 1-year-old is understanding language, being able to do the things I outlined on an age-appropriate basis, you don't have to worry. And if you are worried, first bring your child for a hearing test to rule out hearing loss. But the line in the sand is when your child turns 2 years old. And if your child is not yet putting 2 words together like daddy home and puppy sick, and your child does not have a vocabulary greater than 50 words, then your child is below what 90% of children can do on the 2nd birthday, and it's time for a speech evaluation. If you're concerned about your child's speech, I have a course for parents on my website, speaktomeplease.com, and the course helps parents to listen to their child's speech, identify different factors, and go through the workbook and identify why the child is struggling, because it's important to know why a child is struggling with speech. Some reasons are structural in the mouth, some are hearing related, some are perceptual, some are motor programming, some are muscle based, some are cognitive. There are many different reasons why a child would not speak as expected, and if you're a parent who wants to find out why, go to the website and take a look at the course. I haven't had time in this video to go over the structural reasons why a child may have difficulty speaking, but please watch my video about tongue tie, which is one of the reasons if you're concerned about this for your child. You may also watch the video, Is My Child Speaking in Sentences Yet?, if you're confused about whether your child is actually saying sentences or not saying sentences. Thanks for watching.